Good afternoon, good evening, everyone. My name is Julian Fisher. Thank you very much for the kind introduction there, Fiona. Just to say that I am actually a dentist. I graduated in Birmingham University many moons ago, but have through my career obviously perhaps moved beyond dentistry and health, and now work with UNESCO on education and the environment. So very pleased to be invited to give the final presentation of the Professor Robert Ireland annual lecture today. And I suppose this takes a completely different view. It's much more of a global perspective, much bigger perspective. But on the other hand, it links very much back to Juliet and Mike's presentation. So what I've done is really try to look at the sort of the big global agenda, give you a perspective of perhaps things coming not in the so distant future and how that might affect our thinking and our working, but also link it into what we're doing in general practice and everyday routines. And just to highlight that at the moment I'm in the Charité University in the dental department, which is in Berlin in Germany. So what I'd like to do is as Fiona said, break it up into 3 blocks. So a first block looking at the oral health resolution that came out this year and the draft strategy. Also talk about climate change and oral health, and then have a pause for some questions. So again, write in the chat any questions. Hopefully Fiona can pick those up. And we've got a few questions between ourselves. Then looking at oral health and the Sustainable Development Goals as a way of integrating health into the bigger agenda, and perhaps looking at the advantages of that, looking a little bit at the social determinants, and a couple of comments there. I think Heidi Cresswell mentioned the inequalities in linking to diabetes. And at the very end, really looking at some opportunities that this resolution and this new way of thinking allows us to do in engaging with the health programs and also other sectors beyond health. So that's the lineup of today. And the first question, I suppose, is global oral health. We'll come to perhaps what we mean by global oral health, but also why act now? And I think there's 2 really very strong lines here. One is the policy. We'll come to that in a second, that oral health is now a sort of, well, it is a global oral health policy. And the other aspect is planetary health to inevitably have a big effect on oral health and oral health care in the not distant, so distant future. And again, a few stories from colleagues around the world who are experiencing the effect of climate change and what does that mean for your daily working life. And I always think it's really nice to look back as we look forward. So quite interestingly, the last time that oral health was on the World Health Organization agenda was over 10 years ago. And what is really very, very encouraging is that despite COVID and a lot of pressure for other issues to be considered, ministers of health from all around the world decided, no, oral health is a global health priority. So it was actually put on the agenda of the executive board this year and came to the World Health Assembly. Now, the World Health Assembly is held every year in Geneva in May, and it's comprised of all 194 member states. So all the ministers of health come to Geneva, and they really talk about big issues, things that need to be considered at a global level. And oral health this year was considered absolutely crucial to consider at a global level. And so the World Health Assembly then looks at a resolution on oral health, if you like, a document describing why oral health is so important, and votes on it. And it voted in May this year to adopt this resolution, which has then consequences. So in a way, this is really important for us as a dental team, as an oral health team, because it's not just good to know. It's not kind of, yeah, the oral health resolution is adopted. This is going to inevitably influence and impact your working lives over the next decade and perhaps longer. So what I want to try and do is tell you a little bit about the resolution, and particularly about the strategy and the action plan coming up, because those will be taken, if you like, the ministers of health do these things at a global level. There's a global strategy and a global action plan, but those are all taken back into the national context. So in the UK, in Germany, in Malawi, and India, and they're then implemented at a national level. So it takes some time, but eventually what you're seeing in these documents will start to filter through to a national level, and then obviously from then on into your practice. And as I say, big difference between the oral health resolution of 10 years ago and the oral health resolution this year is that 10 years ago, oral health, again, the resolution was quite standalone. All the same issues, effectively, that we've got in the resolution this time are all still there. You know, integration, the burden of disease, the social determinants, they were all mentioned 10 years ago. The big difference this time around is it's not standalone, we're connected. We're connected to all the other big agendas, social determinants, health workforce, sustainable development goals. So it's really taking oral health, and quite often we've got the expression putting the mouth back into the body or oral health being neglected. This is where governments are now saying we need to connect oral health to the body, as we've just heard from Juliet and the questions there. We need politically to start embedding oral health into the bigger agendas. No longer is it this small area off to one side. We need to bring it home into the middle, into the main health agendas. And we've seen that happening during the COVID pandemic. And as I say, we had the resolution in May, and in August, the WHO published the global strategy and highlighted that there will be an action plan coming out next year. So just to give you the timeline, it's not short, but on the other hand, when the next 2 years are going to be very, very critical for oral health and an action plan at a global level, as I say, that will be taken up into national policy. And what's really exciting, and I'll come to it in 2 seconds, but I think this strategy really just emphasizes almost what happened 10 years ago. Oral healthcare systems are inadequately funded, highly specialized, isolated from the broader health system, particularly in terms of oral health workforce. That's not really connected to population oral health needs. So there's no, often very little connection and alignment between the needs of people and the health workforce. And then obviously dental training is not well integrated into general health training. And certainly that my work giving this lecture or a series of lectures on global oral health through the world, that is really coming through. It's very difficult to get medical colleagues or faculty to really sort of absorb and take on board oral health, although it is starting to happen, as we've heard from Anna and also from Juliet about some of the things that happen in the UK. And one of the key sentences, I think, for the audience today is that it notices that the education focuses on highly specialized dentists rather than community health workers, dental assistants, dental nurses, dental therapists, and dental hygienists. So really, really encouraging and great to see dental assistants and dental nurses mentioned now in the global oral health strategy, looking at this oral health workforce. So just to let you know, there's a real call out for all the different cadres that are involved in oral health. However, when looking at the strategy, one of the things that I picked up was the number of terms that are included in the strategy. You've got dentists, oral health care providers, mid-level providers, community health providers, dental professionals, oral health professionals. So there's a lot of terms that perhaps we need to look at. And I know Fiona and the group that I've been working with have been looking at, well, how do we describe ourselves? If we're moving beyond dentistry, if we're getting into oral health, you know, what does that mean? And what does that mean for what we call ourselves? And probably one of the biggest, an area I work with in WHO, with the Health Workforce Department, is looking at education, but particularly in the strategy, it talks about a new oral health workforce model. So a model that responds to population needs, and that those needs better inform the training that everyone gets. and particularly from some of the conversations we've been having today and also broader, this idea of universal health coverage, making sure that many more people get oral health services and care, and it's not financially crippling. So accessing the care is improved, coverage of care is improved, but also looking at the financing, that people can afford it and it's accessible. And in the WHO strategy, it says, well, if we're going to do that, then we need to look at the roles and competencies of dental nurses, of therapists and hygienists. And that was the question: should we be doing blood pressure? Should we be doing other investigations? And my answer would be very much so, but in liaison and working with other health professions. And again, just two, so if you like, that's looking at the health workforce. But the other big thing is, and don't forget, these resolution and the strategy are really political messaging. It's giving you a direction of travel. Where is oral health going over the next decade? And how can you prepare for that and start thinking, well, if this is going to be what governments are looking for, how can we prepare for that? A couple of takeaways are, one is that the strategy grounds oral health in sustainable development. So it's saying oral health belongs in health, but oral health also belongs in sustainable development. And we'll come to that in the second part. There's a real move to look at dentistry and sustainability, oral health and sustainable development. So that's a really big new area opening up, and that offers a number of opportunities for us. The other thing in the report, it notes planetary health. Again, we're not going to get around climate change and the issues of climate change, and conversely, the impact that dental care has on the planet. So again, oral health positioned in these big agendas. And then certainly we've got the Minamata Convention, and through that work about looking at environmental impact of dentistry, there is a call in the resolution and the action and the strategy for environmentally friendly, less invasive dentistry. So many of the things that we've been talking about are in the strategy and the resolution, but it's also positioning oral health in the really big agenda. So we've looked at the policy. This is where we're going for, moving into the bigger agenda. But in terms of services and care, what are some of the impacts? As I was saying, that was the policy. Now we're perhaps looking at the climate change. I'll come to the meeting we've got in Glasgow at the COP26 Climate Change Summit. But if you look at the IPCC report and you look at the issues and the environmental hazards, heat waves and air pollution are going to be really two big problems in Europe. So we're also seeing now, so not only are you getting political movement, we're also getting real-time, problems through climate change. So for instance, we had huge floods in the south of Germany that knocked out many, many communities and dental practices. I've got colleagues in America who are in California and saying, Julian, we haven't been able to work for 3 days because there's no electricity. Water is becoming very difficult to get on a regular basis. And also people don't want to go outside because of the pollution. So the model of practice is going to be stressed, as with many other issues. And there's a very nice article on climate change and oral health that talks about the clinical aspects of that heat, the heat stress, particularly on the elderly and younger people. Poor air quality. What does that mean for oral health? Food, water insecurity, we'll come to that in a second. Vector-borne illnesses, again, a rise and global movement in terms of the illness epidemiology. And then, as we've seen, the big social factors that we're seeing with COVID, but this is also going to happen with climate change, which is inevitably going to impact supply chains, energy supply, and also political stability. So there's huge numbers of issues coming down the line. It will affect insurance policies for general practice. So it can't be business as usual from the perspective of oral health. We need to reach more people. But in terms of climate change, it won't be business as usual. Climate change will affect, as with everyone else, it will affect dentistry and dental care and oral health care. And again, an example of a colleague from New Delhi looking out of the window 2 or 3 years ago, huge air pollution. So the idea of mobility, everyone traveling to the dentist, he said, Julian, people just aren't coming to see me because the government is saying, we recommend you to stay inside. So again, he had electricity, he had water, but no one was coming to see him because there was such pollution for 10 days. No one was moving around, not least because the number of road accidents was increasing because people couldn't see because of the smog. So again, looking at that model of everyone coming to the dentist, and Fiona and our group have been talking about, well, can we get oral health care distributed into the community and more community-based? Sustainability is now really at the top of the dental agenda. The World Dental Federation has now got an initiative looking at sustainability in dentistry, looking at not only those bigger issues, but also what are we suggesting and providing to our patients? What's the environmental impact of that? A lot of studies from colleagues in Ireland, Brett Duane, I'm coming out with a book in December, looking at all these aspects, saying this is a new frontier that we need to start looking at, this environmental impact. So again, the environmental impact and sustainability in dentistry, again, coming through both the political drivers, but also the societal and climate change drivers. And we've got a meeting now on global oral health at the climate change conference in Glasgow. Very pleased if colleagues and participants would like to engage. We've got a group of dental nurses, and Fiona and her team will be presenting, because what we want to try and do is look at a snapshot of dentistry and oral health from perspectives of organizations and students around the world. So I've been giving a lecture or a series of webinars on global oral health to over 20 institutions and organizations around the world. And we're hoping to have a snapshot from Japan all the way through Southeast Asia, Europe, out to the US and to Latin America. So people can start seeing, what is the state of dentistry, what's happening, and what are some of the challenges. And the other thing for younger colleagues is a group have come together and said, actually, we need a youth manifesto to look at sustainable oral health, and we need action, because this is our agenda. And when I talk to students in Italy, they're saying, Julian, we don't get taught about climate change. We don't get taught about sustainability. We understand these issues are going to be affecting us, and we really need to do something now. So there's a manifesto that's just been launched, and we'll be presenting this and the results of the manifesto in Glasgow. When people think about global oral health, they think it must be a new discipline, a new thing to learn. But the way I see it is, it's very much about learning from other countries, what they're doing in their countries, how they're developing their workforce, how they're delivering oral health care. So it's about learning from and with each other, rather than this is a particular discipline. And quite interestingly, I was on a call with 200 dental therapists in Indonesia and Malaysia, and I found out that actually dental nurses in China are registered nurses. They have to be a registered nurse before they become a dental nurse. So again, these models around the world are very interesting. As this global oral health agenda through the WHO come through, we can start saying, well, if there are benefits for dental nurses being trained as a regular registered nurse. So again, seeing how those different models can be incorporated. I'm very, very pleased, as Fiona said, when we're looking at this new oral health workforce, we've got a group of dental nurses from around the world who are looking at this, looking at framing oral health from the perspective of dental nursing within the Sustainable Development Goals, and also looking at this new competency framework. What new skills, what new competencies do dental nurses or oral health community providers need? So again, this WHO resolution has started to precipitate, to start off these conversations. And if you look at what the WHO is looking for in terms of skills and competencies, in terms of public health, in terms of social determinants, It's all these big issues. So we're not far off when we start saying we need to move in this direction, because that's what WHO, and don't forget, WHO is only a secretariat for governments. So in a way, governments are saying we need to look at health, but we need to look at health and its contribution to tackling these bigger problems. And this is exactly what the WHO, the second paragraph said, grounding it in the Sustainable Development Goals, framing oral health within sustainable development, because we've got wicked problems and they are not going to be solved by either dentists or the dental team or the oral health team or the health team for that matter. These needs to be addressed by many, many different groups, all working together, all understanding, as Professor Ireland said, we've got to understand each other, and other people have got to understand oral health if we're going to find these wicked solutions. And this is, I suppose, where the Sustainable Development Goals come in. You've got highly complex problems that are very, very difficult to untangle. Our best way is through the Sustainable Development Goals. They're the only global approach and structure that we have. So therefore, if we're going to join and integrate, we need to start thinking, well, where does oral health fit into the Sustainable Development Goals? And traditionally, as we've been hearing today, we've tended to focus purely on non-communicable diseases. So this is Sustainable Development Goal 3, and they have a number of targets, and 3.4 is the target on non-communicable diseases. And I suppose that's pretty much where we've focused, and for good reason. But this is a colleague, Rita Vilena, in Lima and Peru, and she goes out into the community, and she says, actually, I want to get people in the community when they're thinking about having children, when they're forming their families, when they're having difficulties in their life, and I start looking after them. And so she has developed an area called infant dentistry, and she takes on young mothers, pregnant women, and saying, my job is to look after the oral health of your child all the way through your life. And that means not just waiting until your child's got teeth. That's actually going out and working with you to change your diet, to start preventing these non-communicable diseases right at the first moments of life. So complete mind change in the patients and the communities of where oral health comes in, and also very receptive to that initial engagement in when the child is very young and an infant. I worked in South Africa, an HIV hospital, and just picking up on Professor Ireland's point, I was part of a medical team. So I was part of a medical team looking after HIV co-infected patients with TB. And quite often they would say, Julian, we've got a real problem. As Mike said, we can't give fluconazole because the patients have got mouths that just are too uncomfortable. Can you do anything about it? Simple, basic oral hygiene, huge improvement in people's mouths. They could then take oral medication, and you were a part of a medical team. So sometimes I think our barrier is that we go with caries or perio and say to the medical colleagues, here's oral health, here's our oral diseases, here is all the evidence, rather than saying, actually, tell us about diabetes, tell us about your problems, tell us about Alzheimer's, and we can see where oral health fits. And you'll understand that logic a little bit in a second. Universal health coverage, again, oral health now being adopted at the UN level. So not at the WHO level. This is the big UN. So all the different agencies. So there was a UN declaration on universal health coverage, and oral health was in there. So we're also embedded in the biggest agenda at a global level. And if you look then back at the Sustainable Development Goal 3, we're in all those targets, which is not surprising for us as oral health professionals. We're in infant and newborn childhood health. We're in reproductive health. We're in HIV. We're in neglected tropical diseases. We're in NCDs. We're in prevention and control of substance abuse, tobacco control. And all of a sudden, from being one, we've now expanded, and actually we should be engaged in many, many more health programs. This is a colleague I work with in northern Nigeria who sees a terrible condition called NOMA. And this is, if you like, a potential extension of ANUG, very, very aggressive infection that destroys the soft tissue and hard tissue of the face. Again, it's been a global priority. but you're not going to address this disease in a purely health intervention, because it's to do with poverty, it's to do with hunger, education, gender inequalities. So again, we need to start thinking of oral health, and this is a really good example, both practically helping patients, but also politically, of explaining where oral health fits in to these bigger agendas. And what's happened then through the work on NOMA, which is what this cancrum oris, which is what this condition's called, we've got engagement in the African region, and we've got Médecins Sans Frontières now saying, you know what, we need oral health training. We recognize in our camps and in our work, we don't know anything about oral health, and we need it. So again, through NOMA, we're starting to engage partners who perhaps you wouldn't have thought of working with. And they're coming to do, hopefully, a training program on oral health that I have here at the University in Berlin. And the other thing is, okay, how do we get oral health grounded in the Sustainable Development Goals? Have you got an example? Well, 3.9 is looking at hazardous chemicals. So it's looking at waste. And this is an example of, here's oral health, and how does it link into other goals? Well, that addressing chemicals is also in SDG 6 on water and SDG 12 on consumption. So you've got a link between oral health, the big health agenda, and then two other sectors. Because I think Heidi was mentioning, you know, this is work by WHO, the social and environmental causes impact our health far more than the healthcare itself. So those social and environmental determinants have a much bigger impact on our health than the healthcare. So we need to start looking at the social environmental determinants of health. So we were just talking about the environmentally less invasive dentistry. This is a huge opportunity for your cadres, for dental nurses, for oral health providers to get involved in the prevention in human health, but also looking after the planet as well. And the oral health resolution actually says this. We need to start shifting away from dental amalgam restorative care, which has served us well. And we need to start looking at a more preventative model of dentistry. So again, coming back to the workforce, what workforce do we need? What training do we need if this is where governments want to go? And I worked for over 15 years, right from the very beginning of the Minamata Convention, and have been involved in some of the country level implementation that's happening now. And we worked so hard for 5 years, and it was so gratifying that in an environmental and health convention, when it came to the provision on dental amalgam, the very first measure was setting national objectives aiming at dental caries prevention and health promotion. And often people miss that in that convention, you've got all health system change. And the very first measure was about caries prevention and disease prevention, which again lends itself to this call for less invasive, environmentally friendly dentistry. And again, if you look at restorative dentistry, as I was saying, colleagues in the US, the killer assumption is we're always going to have water for restorative dentistry. And the UN, and this is the Lancet Commission report on planetary health from 2015, the UN has said that by 2050, 40% of the world's population is going to be living in areas under water stress. A little bit further away, but 20 years, but you can hear California, Australia, South Africa, India are already experiencing water stress. And I know dental colleagues now who have actually had to install generators and water collection to make sure that they've got a backup just in case the public supply goes. So this idea we're always going to have water for restorative dentistry may not always hold true. And the connection, planetary health, is always termed often in abstract terms. But again, the Lancet Commission said, you know what, in terms of planetary health, in terms of climate change, the IPCC report said the same thing. We've actually created this ourselves through our decisions as societies and politics. We've created many of these problems ourselves, and we need to start looking at the environmental and social determinants of health. And this is Flint, Michigan, a very well-known case of water pollution. And again, it comes down to Heidi's point about inequalities. When we're looking at oral health care and the advice that we give to patients, we really need to understand the living conditions of those patients. This was when they had terrible water pollution. The communities were experiencing very traumatic and upsetting situation with their water. Barack Obama came along and said, you know what, I'm drinking your water. And I haven't got the picture, but a gentleman in the audience held up a bottle which was virtually yellow, saying, that's not our water, this is our water. So again, real inequalities, and we need to start addressing those, which is what the oral health resolution and the draft strategy do. Why are the social determinants important for oral health and our work? Is because, and again, I was involved in this high-level commission through a report from UNESCO about education. The vision that came out of this UN report on health workforce that was led by the president of France and the president of South Africa was the workforce should be geared towards the social determinants of health. Primary healthcare, people-centered community services. Exactly what many people on this call believe in and actually do. So again, the investment is going to be looking at cadres that focus on this type of activity. And again, the social determinants, there's a very nice linking between the social determinants and the sustainable development goals. So that for me takes highly complex problems and also looks at some solutions, again, which is what Fiona and her group have been doing. And one last point, I've been working on a manual, a starter guide for the World Health Organization, looking at training health workers, all health workers, on the social determinants. And a lot of the work that I do is based on this manual, hopefully coming out in December, and there's an oral health chapter. So I'll be talking about the social determinants in a second, but it's just letting everyone know that as I think it was Stephanie or the last HP said, your cadres are really, and as Professor Ireland said, your cadres are a critical workforce that can be much more easily integrated into a bigger picture. So I just wanted to touch on this. Very nice picture from Aubrey-Shire, really fantastic gentleman who did a lot of work on the social determinants. And he made this very nice diagram of the dentists just doing their own thing, not really looking at the bigger picture. I worked for the World Dental Federation in Geneva for 7 years, and we developed a caries matrix. And most of it was looking at how do we classify disease. And right in the bottom left-hand corner was health. And really, to me, after perhaps many years of reflecting on that, it is quite telling how our education really focuses on restorative dentistry as a dentist and very little on promoting someone's health and looking after them. And through my work on the WHO book, we came up with this question. Is it sufficient, and it picks up on Heidi's point, is it sufficient to treat people's illnesses without changing the conditions that made them sick in the first place? And you can switch that into education. Is it sufficient to educate and train health workers to treat people's illnesses without educating and training them to change the conditions that made people sick in the first place? You know, great having diet advice, but my experience in clinical practice is if someone's on a night shift and they are depressed, it is very difficult for that person on their own to really start changing their diet. And so how does the social determinants help us link all this together? Well, we actually look at the social determinants quite often in a person and in a person's mouths. Juliet mentioned we're seeing people on a regular basis, often people who perhaps don't see themselves as sick, and they go to the doctor. And we often get healthy patients or people who perceive themselves to be healthy. And we can then map the social determinants in their mouth. Again, we can look at the biome, a really important new development. We really need to start looking at non-communicable diseases in terms of the oral biome. And there's a nice paper coming out in the British Dental Journal about that soon, because then we can start looking at inequalities. We can looking at sugar exposure. And a lot of the evidence that went to the WHO guideline about sugar intake for adults and children came from caries work. And then we can link the social determinants to the bigger issues around sustainable development. So for me, there's a really nice opportunity to do this and to link in. Because the social determinants are the conditions that we all live, work, grow, and age in. So again, what we've been talking about and what many of us see in our general practice. And it's looking at those root causes. So it's not just sticking at behavior and trying to cheat Jesse's illness. It's actually saying, what's the local environment that that child, that family live in? And what are the policies that are leading towards the child becoming sick? So we need to start thinking of how can we work at a local community level, but also looking at a policy level, not just in health, but outside health, in education, in employment, in urban planning. Again, I think we've been talking, not everyone lies on a social gradient, and those social determinants of health, employment, housing, nutrition, education, income, are all going to be factors that influence someone getting sick with caries or periodontal disease, but how their ability to respond to what you're telling them that they should do. And again, that's a policy issue, and we can link that nicely to the social determinants. And we do a lot of this work already in our practice, either through dental charting, social history taking, management plans. We take a lot of this work already. And as I work for the World Health Professions Alliance with the doctors and the nurses and the midwives and the physiotherapists, to Professor Ireland, it would be very nice to see. We use your RAG idea, red, orange, green, to look at the risk factors for non-communicable diseases. And then I took that work forward in the University of Lyon to take that RAG system and link risk factors for non-communicable diseases with the risk factors for caries and periodontal disease that really people and patients really liked, because they could see it as a vector. So you could plot people's risk factors and say, well, these are your risk factors. And then we could look at the social determinants and say, why are your risk factors here? Can you push that one in? I can't do that one, but I can do this one. And that idea of a vector, of not a linear thing, but a vector saying, well, let's try and juggle this given your life situations at the moment and see what we can do. And so often that came to, well, what medicines have we got? How can we help people? Really nice. As one part of the resolution and the strategy, WHO for the first time is now introducing oral health products, if you like, into the model list of essential medicines. Fluoride toothpaste, glass ionomer cement, and silvadiamine fluoride. Those will become hopefully included in the essential medicines list, and that will have a real impact on legislation and regulation and enable us to start being integrated into the medical field and have medical products that are for health and for oral health. So all these little things are all mounting up. And then again, I heard, I think Anna Ireland saying the new health person in the government is a biomedical person. Again, biometrics, looking at not just fluoride, but what other things can we do that help the body repair itself? So again, looking at mouthwashes, looking at fluoride toothpaste, looking at other things that we have, how can we start looking at those products to sort of start mimicking the body's responses to disease, looking at the oral biome, considering the oral biome, and then thinking about, well, how our products can help and repair the body at the same time. And for me, this is a big shift from repairing oral diseases, which is what we've been talking about, highly specialized, to basically looking at keeping on people on a spectrum of oral health throughout their life course. So that spectrum of oral health will shuffle and move depending on their social circumstances, depending on their life course. And our job is to walk with that person, with that family, with that community, and say, our job is to walk with you to make sure that your oral health is always in the positive area. And that's our job. It's not to repair the disease. It's actually to say we're part of a bigger team. You have a spectrum of oral health, and our job is just to make sure that you keep in that spectrum of oral health. And so I like to think of a new model of sustainable oral health that takes the oral biome, takes the gut biome. Again, a huge link potentially between the oral cavity and the gut, the stomach. That's the most obvious linkage for many people, and they can understand that. And we're learning a lot more about the gut biome in terms of Alzheimer's. So there's a lot more information about the gut to Alzheimer's, and it makes complete common sense to say your oral cavity is part of the alimentary system, and that needs to be considered, and the biome of that needs to be considered, and we need to look at the linkages between the oral cavity and the stomach, and then, as Juliet said, the linkages to other diseases. And through that, and through preventative caries management, we can look at the social determinants, and as I've showed, link back into the Sustainable Development Goals. So a much bigger, broader idea of oral health. And we're not starting from ground zero. We've got a lot of tools that have been developed, and there are a few gaps, but my thought is that it's actually a matter of linking all these things and I think it was Professor Ireland who said, it's about understanding and hearing what everyone is doing. And sometimes when you reach out and listen, you find actually all the information is out there. All you need to do is pull it together into a holistic, comprehensive model. And we don't have to, it's not a matter of reinventing the wheel. It's all out there. It's a matter of pulling those pieces of the puzzle in and then building the puzzle.
Okay.
And then for me, the last thing is looking at the mouth. If we have this idea, we've got a unifying narrative for oral health. It's linking the mouth as a gateway. I like this idea. The mouth as a gateway and senses the response to the external world, and at the same time reflects what's happening inside our body. So rather than these very complicated definitions of what dentistry or oral health is, for me, I think that from a patient point of view, they can understand that very nicely. And the last slide, again, looking at the COP26, it's going to be very, very interesting listening to Fiona's group coming to present. And the idea is that using the Sustainable Development Goals, I've been able to get students in Italy, students in Peru, to all start working off the common platform and start communicating together, sharing ideas, sharing what they're doing to kind of build this global community and these ideas of oral health so that we can learn from each other and build a model.